Welcome to the Hub and Spoken podcast series, the podcast for business and data leaders interested in organizational growth through the use of data and analytics. We explore how you add value and what considerations there are to get things done. I'm your host, Jason Foster, founder and CEO at Cynozure, and I'm really pleased to bring you this show. Don't forget to check out our website, subscribe to our newsletter, and follow us across social channels. We hope you enjoy the show. Hi everyone, and welcome back to the show. I am absolutely delighted to have a very good industry friend of mine, Dr. Johanna Hutchinson, with me today. Johanna was last on the show in 2018 when she was the Chief Data Officer at the Pensions Regulator. Since then, done some various things, but seconded over to the Department of Health and Social Care as Head of Analysis for COVID-19 response when the pandemic was just taking hold back in April 2020, and then formally took up a position as Director of Data and Data Science at the Joint Biosecurity Centre, test and trace, and all those sorts of things towards the end of 2020. Also, since then, Johanna's been voted in the top 10 most influential people in data this year by DataIQ. So, Johanna, I'm absolutely thrilled to have you back. Love talking to you. I'm really pleased to have you on to talk about how we have managed the COVID response at a national level using data-driven decision-making. So welcome back to the show.
Thank you. It's lovely to be with you.
So I've given a bit of an intro there. I've used lots of words that were relatively new to me around how the setup of government was for the COVID response, things like Joint Biosecurity Centre and the Department of Health and Social Care. So can you kick off with just sort of giving us a bit of background about you and what the Joint Biosecurity Centre is, how test and trace, that machine sort of got set up and how it fit into the sort of overall COVID response?
So yeah, I work as a civil servant. I've been in the civil service now for 10 years with a background in academia. And over the past sort of 5 years, my focus has really been on data-led transformations within government departments, and usually to enable better analytics within government departments, which enables us to do better evidence-based decision-making. So really when COVID hit, we recognised that actually the evidence and the analysis and the data that flows from the health agencies, so NHS and PHE, was going to be absolutely critical in advising government on this largely unknown at the time virus that was going to go through the population, and that much we did know, and the impacts on society and on the country as a whole. So in April 2020, I moved back to the Department of Health and Social Care, which was at the time a relatively small government department of around 700 people and largely policy based. So looking at the policies of health across the country, but supported really well by Public Health England and the NHS. And Public Health England and the NHS were their data orientated departments. So all of the collection of operational data, understanding of infectious diseases, of all hazards from a health security perspective would come from those departments. So what happened then, of course, was that the Department of Health was needing to establish a new operation to be able to test the country as a whole and to be able to stand up a tracing capability at pace and at scale, and to understand the transmission of disease between those testing positive and those that they'd been in contact with. And so the Test and Trace programme was born, and it was born into the Department of Health and Social Care, but ran as an operation alongside it. So the Department of Health and Social Care went from around 700 people to probably double that size in the case of just a few months. Yeah. And the Joint Biosecurity Centre was the concept of the Cabinet Office. And it was really about health security being on the front foot and on the agenda of number 10 in the Cabinet Office on a daily basis. Right. And how do we bring together the analysis and the data that we have on health security to be able to advise ministers on the threats to our country in real time, in effect. And so the Joint Biosecurity Centre was born and then moved alongside Test and Trace with a view to provide the evidence base and the objective analysis and assessment to advise at a local level, but also at a national decision making and the response to COVID across the past 18 months or so. So we remain there. We announced a new change to how we'll work going forward, recognising now and particularly coming out of the G7 summit, that health security is on the forefront of the government's agenda. So how do we manage the impact of potential pandemics coming forwards in the future? We've seen Ebola, we've seen SARS, we've seen swine flu, we've seen all kinds of different threats. But this, of course, is the worst infectious disease to have gone through our population in probably 100 years since the Spanish flu. So how do we monitor that across the world and do that piece going forwards, recognising that the world is much more interconnected? And the solution is the UK Health Security Agency, which is the amalgamation of Public Health England, Test and Trace as an operation, and the Joint Biosecurity Centre as a permanent capability to be able to advise on health security, coming together to form that new organisation and be able to build on the excellence of COVID to understand how we lead in health security going forwards.
Brilliant. I mean, there's so much change. There is so much change to. I mean, we were going through a period of time which was hugely uncertain, and then layering all that change on top. In the public, there was a lot of change going on in the public and how people live their daily lives. But at the sort of centre of the response, there was also this huge amount of transition and change and movement and new organisational structures and new teams being set up. And of course, you got seconded from a different government department, and so there's all the regulator. So there's kind of all this change happening. Did that kind of put a fire, up everybody, or was this sort of hugely disruptive as well? Was it more positive? Has it been more positive than challenging in some ways?
So there's reflecting back over that time, there's positives and negatives. At the time, what it enabled us to do was to put together an operation the size of the Asda estate, for example, in the place of a few months, aligned with all of the other work that was going on in the healthcare system with PPE, which we remember going through, working with the NHS, who of course were looking at hospital capacity and deaths, those sort of prevailing elements around the COVID response. There's huge public scrutiny. There's a need to be able to integrate and access data that is either a new flow of data or is coming through relatively old surveillance systems, as has been discussed about PHE, and to be able to pull that together at pace with a decent understanding of quality to advise on the next decision of government. That's been quite a piece.
Yeah.
Reflecting on the moment that we have now, where we again are seeing an increase in cases, we're aware that the policy decisions of the time are now to open up the country because of the successful vaccination programme, which we hope will enable us to be able to develop a new way of living in the UK with the virus and maintain the services and structures that we need in the NHS and food manufacturing and schools to enable us to continue an open kind of life. That's a different policy to go forwards on. So from a JBC perspective, we're still actively monitoring and controlling the data flows that come from there. And of course, the teams are now tired. So we have pulled blended teams together using consultants, using contingent labour and using the best of the civil service to manage this. And people have been with us for quite some time. A lot of flux, but also a lot of people who have built a lot of knowledge up and remain with us. So the challenge really is how to maintain the pace that's needed with a workforce that's worked hard over a long period of time, not just through the crisis periods, but also continually throughout to ensure that we have the data we need at every step of the way.
Yeah, it's such a huge operation, and of course I'm sure I share the thanks that all of our listeners will have to all of that hard work, and without which, and I can't wait to get into a bit more detail about more of the specifics of where that's supported and how it's supported, but without which I'm sure whatever your view on how positive or negative our collective response would have been not as good. I think I think it's fascinating, and I think the other sort of thing that jumps into mind here is often the public sector is thought of as not being able to move quickly, not being agile, not being innovative. And I know that's changing and the culture of that is changing, but this just proves what can be done when the focus and the right minds are on the job. So I think it's a huge sort of congratulations and a good demonstration of what's possible.
No, absolutely. And the understanding and acceptance of the use of data to be able to make decisions has been really fundamental to this. And the major advocates here have been Professor Chris Whitty and Professor Jonathan Van Tam, who as chief medical officers have held that line very firmly. So also held the line of being independent in terms of being medical advisors, and so not political and making the decision. And that's really enforced from a civil service perspective, that we can provide advice, whereas we are not making decisions.
Yeah.
That's been absolutely brilliant from a evidence-based policy-making decision perspective, and really ensuring that data is at the forefront of the decisions that go through.
I think it's been a great case study for that, hasn't it? Because lots of, and we've talked about this many times over the years, the sort of cultural challenge of helping an organization to move to a point where they're using data to help guide, drive, support their decision making, and how difficult that can be and how challenging that can be, and often that's a bit of a top down requirement. If it's being seen at a sort of senior level, that's happening, that can permeate out. This is a brilliant case study for where that's happened, and it's in the public vernacular. I talk to people, are you going to go on holiday? Well, people say, well, let's see what the data says, and that has just, we've never had that before, and I think that's definitely shone through from a citizen perspective. That's really clear, and sometimes almost in ways that you could never have imagined, right? And I think that's been great to see from the centre.
Yeah, data not dates. What a simple concept that actually everybody understood, spoke about, and got on board with.
Yeah, it's brilliant. Can we talk a bit more about some of the specifics then? Because I think you've talked sort of conceptually there about, or sort of broadly there about, the kind of ways that data has been used. I'm fascinated because you've got benefit of hindsight as well. Now we're sort of 18 months in, and so just really interested in how data has been used. What kind of things that sort of were part of the response that people will know about, and how and where data played a part in that. Are you able to share some of those things from maybe some examples from early days, some middle, and sort of more recent?
Yeah, no, absolutely. So I can talk through some of the major decisions that were made with data from the Joint Biosecurity Centre and the work that we did from that perspective. And then, really interested to just touch base on some of the new and innovative stuff that's come from partnerships with academia, because one of the other advantages of this is that actually we've been partnered really firmly with the academic community through this. Okay. So some of the new and novel insights that have brought through have been brilliant, and wouldn't have been possible if we hadn't have worked in this way.
Great.
So when JBC was set up, over 12 months ago, so 13th of May last year, and one of the first decisions that we got involved with was the Leicester lockdown. I don't know if you remember that. It was in the early days of summer, and really looking at an increasing case rate in a local community, so a local city, and how we would handle that. And so Leicester was locked down based on JBC data and analysis from that particular time. And on the back of that, very quickly became the Contain framework and the international travel corridors. And the international travel corridors are assessments of over 250 countries, territories and islands that are done on a 3-weekly basis. And that work has continued to this day. So it's a firm methodology. We understand the traffic light system of green, amber and red, and the analysis has been consistent over that time period. So it's really withstood the test of time, albeit it's been very messy over the summer periods, where people have been challenged with whether to come home from holiday early or not. Going into last autumn, we really worked hard on the early warning system and the national alert levels. Yeah. The national alert level goes from 1 to 5, and then signed off by the Chief Medical Officer, by Chris Whitty, with an understanding of what the health security level of the country is at a time. And it is aligned to other security alert levels that we've seen for terrorism over the course of time. So again, that sort of health check. That
one definitely, as a citizen, that had familiar tones to it in terms of how we track other emergency responses. So it kind of, from a simplified kind of understanding of where are we, how bad is it, how good is it, that was super helpful.
In October, we introduced the tiering system. This was quite contentious: tier 1, tier 2, tier 3. And I benefited most from being in the Isle of Wight, being in tier 1. And no, I didn't fiddle the data. But we saw going into Christmas that actually the tiering system was being overrun by the variant that came through. And some of the modelling that was done from the team, which uses mobility data, enabled us to track the variant across England. And that was phenomenal and really interesting to watch which areas get hit first when one area of the country ends up with a high case rate.
Do we still have the tiering?
Tiering been relaxed for the period. So what we're looking at are national initiatives at the moment.
Right.
But, who knows where we'll go in
back.
the autumn.
Yeah.
Particularly when we're seeing sort of prevailing high case rates in the north again, and what impact that has. We had national lockdowns, so we advised on national lockdowns. And you remember there was one in October, November time. And then, of course, watching that variant rise, we were a very awful time in December for us, where we were advising 3 times a week on the increasing prevalence and case rate over the course of December, when everyone was really busy doing their Christmas shopping and moving around with different Christmas activities, to then have to lock down the country over the Christmas and New Year period.
And when you say on that example, from a data perspective, what was it that you obviously you're not making the decision on the lockdown? Well, you're providing information, you're providing data, providing insight that helps make that decision. What kind of things were you looking at? What insight were you gathering? What assessment were you making?
Yep. So the criteria is looking at 5 different elements. So 5 different elements of the criteria, in effect. Right. One of the main ones is case rate. So looking at the case rate increase and how that compares. So we see patterns in the data. It tends to hit the younger generations first and then creep up through the age groups as it passes through families. And finally, we look at hospital capacity. And of course, this has been a critical factor and remains the critical factor to determine what action needs to be taken. When our hospitals are being overrun with COVID patients, it's the time to take action. And that's been recognised by the ministers and actively used in decision making over the course of the lockdowns that we've seen. So we saw mink farms. Do you remember mink farms in December?
I do, yeah.
Yeah, we had to do all the risk assessments for that. So mink farms are really popular in Denmark and many other European countries, although we don't have them here. But there was a lot of concern then about PHE colleagues were really closely involved with this as to the zoonosis, so whether COVID passes into other animals and then can pass back again. Variants of concern became prominent within the new year. We've seen variants from India and Brazil and Kent all move through the populations, and all are assessed by PHE colleagues in the labs and assessments made by the scientists that come through. And so we monitor that.
On the variants of concerns, not necessarily even data, but just the positioning. The positioning, I think, has been important there, where they switched from naming the country or the place to naming it as the Delta or whatever it may be, because I think there was definite, that had danger written all over it, calling it by the country that it originated, and it just happens to be where it was found and all the rest of it. So from a comms point of view, I think that's been really, I personally think that's been really useful.
I think that has too. And I think probably came to the fore for us quite quickly because, of course, one of the first variants came from the UK. So.
Yeah, absolutely. Well, it took to Delta for it to be changed. So it took for the fourth one. But no, that's been great. It's just taken it's just removed a potential issue that we could really have done without. So.
No, exactly. And then, of course, the vaccine rollout came early in the new year as well. And so we've monitored the effectiveness of the vaccine with colleagues in PHE throughout the course of the past few months and looked at the uptake of that and the impact that that's having on hospitalisations and case rate. And then we're opening up. So then we had the roadmap to open up, which is where data not dates came in. And we've slowly lifted restrictions over the course of the past few months, advising ministers on the appropriateness of different interventions at each point.
So almost everything that bubbled up to the public psyche and citizen, me, and many others, if you've mentioned there. And so really, data and the work that you've done has underpinned almost all of the decision making that's happened. What just from a personal point of view, Johanna, has that weighed on you?
Often you don't have time to think about it. It's incredibly fast paced, and certainly my colleagues who are working in the Health Analysis Directorate, so as data science I sit behind the analysts who are doing a lot of this reporting, and certainly it will weigh heavily on them, and the teams that are literally run ragged to be able to get this data at pace where it needs to be. And bearing in mind, all of our systems are still brand new. So we are still running new systems that literally were coming on board this time last year. Lovely cloud-based platforms, the envy of many government departments, many private businesses, but the pace at which they've been put together and pulled through means that there's still engineering work that needs to be done.
Well, they must change. I mean, they must change all the time. Even the sort of the getting tested to go the PCR and the lateral flow test to go abroad. Every day that's improving in terms of what it remembers and your results from last time and all this kind of thing. It just continually improves. That level, as I said at the start, that level of innovation and that pace of change, is phenomenal. As you say, the envy of other public sector, but would be the envy of any corporate private sector organisation. And again, that's got some pros and cons. The pro is that it was needed and necessary, and it shows what you can do when you need to. The con is probably the personal impact on individuals who have been involved with having to move at such pace and deal with that sort of level of pressure. But yeah, it's just fascinating how much can be done when it's needed.
No, absolutely. And cloud-based systems are they can be spun up. I think that's the learning. You can spin them up and use them pretty much at pace. And
I guess the integration. Sorry, John. I guess the integration with legacy, though, because you're not an island, are you? Whilst lots of new systems, new processes, you're integrating with very established, Public Health England and the NHS and central government cabinet office. They're all established. I imagine have got some older, less flexible systems and processes to integrate with. Has that been a challenge, or is that's kind of just moved at the pace it needed to as well?
I think that's fair to say. In any business, and government's no different, there's a whole difference of platforms that go around, and our surveillance systems, are often bespoke to the disease in which they collect data on.
Yeah.
So there's work to be done, certainly from a health surveillance perspective, to understand how we align that and how we take that forwards. And the opportunity, is now from a UK Health Security Agency perspective to be able to look at what's needed for the future and to be able to have the ambition to be able to plan and design what that needs to be.
Yeah, run that in an integrated way across what were previously distinct parts of government. Yeah,
absolutely. Yeah.
I need to talk to you about poo.
Oh.
You mentioned poo to me, and So what are you giving me a fascinating insight into previously before we started recording into a great data set that was used that helped you speed up learning rather than relying on other data sets that would maybe be a bit slower. So can you talk to me about poo?
Yeah, so as you'll see in the press, one of the new operational capabilities that we've developed through COVID has been the wastewater programme, which we're now badging as environmental monitoring, because I think the application of this goes much greater than COVID. So I have a team who, from its absolute inception, have been researching with DEFRA and the Environment Agency and academic counterparts whether you can detect COVID in the sewer systems. And actually what we found is that we can, and to a high degree of accuracy. So basically, when we poo, we pass out, if we have COVID, we pass out the RNA and the viral load from the virus, and it goes into the sewers, goes around a big mashing machine, of course. And then downstream, we can take samples from there, and from that calculate, and this is where the data and the data science comes back in, of course, we can calculate from a concentration of COVID in that sample and how many upstream within a known population, because we understand the sewer system and how it catches onto the community. We understand approximately, the amount of COVID within a certain community. And that's been, a fundamental game changer in terms of being able to assure and guide a lot of the understanding on case rates, bearing in mind that testing data is only ever as good as the number of people that go for testing.
Yes, and the quality of people's tests and their swabs, and it's such a interesting use case of generally. I think it's great, and the speed at which you can. So not only the quality of the answer, but the speed at which you can run those tests, because obviously there's a bit of a lag when people do a test and send it off and will share the information or whatever. So this is a little bit quicker. It's more quality because you know where it's come from, and it's not personal data either. So it's nice from a a kind of an opt-in perspective, but also just the use case of thinking about what data you can use to help make your decision better, faster, cheaper, quicker, right? Because I think, who would have necessarily thought of that beforehand?
Agreed. And actually, if you want an early warning indicator, if you want something that can do surveillance over the course of time without interrupting people's lives, then this actually is a really useful tool. We're now looking at it in other contexts. So can you use it for other types of infectious diseases or, other capabilities across the health security landscape? And the technology here has also been brilliant. So some of the technology companies that have partnered with us now looking at next generation technology. So can we real-time test sewage? And have the results censored and Wi-Fi'd straight back to the system, so we don't have to have people going down the sewers to collect the data. Looking at the calibration in times of heavy rainfall and being able to monitor the impact of those kinds of things. But also one of the new initiatives is the roving. We have some roving labs that go around as well, so we can actually test and get the results on site and move those back if there's particular areas of concern. And so that becomes a very flexible, very fast and very high quality way to be able to take a snapshot view of COVID within a given society and create that first understanding of where further intervention may be needed.
Fascinating. I think brilliant. Looking forward to seeing where that goes to. So yes, you wanted to talk about academia and your link to academia. So it'd be great to understand sort of some of that and the work you've done there.
Yeah, and a great big shout out to all of the academic colleagues who've stepped up and worked alongside us over the course of the pandemic. We've been absolutely blessed to have the best and the brightest alongside us. We have partnerships with the Turing and the Royal Statistical Society, who are building a lab within our systems to be able to look at modelling and advanced mathematical modelling for various aspects of COVID and beyond. We work hand in hand with epidemiologists, certainly in the health analysis teams, but also the academics alongside wastewater and who evaluate a lot of the pilot studies that have gone through. So we've seen some really, phenomenal work by colleagues who, for example, assessed the mass testing piece that was done in Liverpool towards the end of last year. It was the first initiative of looking at what mass testing would be and how that came through. Just today, we've had papers published on the impact of testing within schools and the positive impact that's had cross-fostered teams. So really giving the opportunity for colleagues internally in government to work alongside academic colleagues to work with operational leads on some of these big programs as well. We're advised really closely by many of our teams. So we published the RUM model on test and trace effectiveness, and its subsequent models will come shortly, which we're working through. SPI-M colleagues, of course, have over the course of the pandemic produced the R value. Yeah. And we take over the calculation of R this week. So right. We've worked with colleagues over the past 7 months to build those models, of which I think there's sort of around 8 or so, rebuilt them into our systems so that we can enable the SPI-M colleagues now to go on and use their time on more advanced modelling to look at the next stage of the pandemic while we take over the regular calculation of R back into the public realm. We looked at mobility data. We've had some great initiatives that looked at how the virus spreads, which we spoke about previously. And again, that's sort of cross-purpose uses. We've had some amazing work done with colleagues on the app data that we've seen coming through, and the app's been a fundamental part of understanding transmission over the course of time. So it's getting a bit of flack in the press currently, but actually is a major data stream for us in understanding where that is going. We are looking now at some of the advanced methodology that's coming through. So, for example, debiasing testing results. Testing results always fluctuate depending on how many people are taking the tests. How do we use data from the REACT survey, the ONS infection survey, and the wastewater data and the testing data? How do we debias those so that actually we've got a really robust measure of prevalence, in effect, that we can use across the winter to understand case rates and the impact of the virus. So yeah, across everything we touch, we're partnered really, really kindly by incredible academic colleagues who have really sort of supported and stood alongside us over time, and really grateful for their support and insight.
It's common purpose, I think, is one of the things that I see binds people together to succeed in this way. And yeah, we've got a pretty common purpose right now. But that level of collaboration, it sometimes can be really hard. You've got to spin up programs, you've got to get budgets, you've got to go around convincing people, change managers, all this kind of stuff. But actually, this level of collaborate, you almost don't have time. You've just got to knuckle down. You've got that common purpose. You've got to work together. But it does take people, right? It's individuals standing up and doing a really positive thing. So again, yeah, it's been amazing to see that, or it's amazing to hear rather, that level of collaborations happened. One of the things I wanted to move on to, and we kind of touched on it a little bit, and you were just talking about the kind of the data side of sort of bias and making sure you're modeling in the right way. The other side of it, and we've talked about some of the sort of simplified messages that have come out off the back of data, but is the challenges of communicating actually quite complex data and insights and the meaning behind them and the decision that's been made because of it to the general public, who certainly 18 months ago probably didn't have a clue about some of this stuff, now are a little bit more savvy. But how much, either your own personal opinion of just the challenges of doing that, and or how much have you been advising on the kind of way of sharing data to help with the messages and stories out to the general public?
Yeah, so many of the messages are come from us or from colleagues in PHE, or are supported in some way. So we've seen some positive aspects of that. We've seen some negative aspects of that. And of course, some things land better than others, and hindsight's a great thing. So working with colleagues in the Cabinet Office and working with the good practice teams from ONS on exactly how we need to communicate with the public has been fundamental to a lot of this. The challenge is that it's a new data set, and often advising on something completely new in terms of policy. So getting that right has been critical. There's some real good successes. So the infographics work really well, and some of the concepts have landed brilliantly. So for example, R, it's not disputed what R is. Above 1 is an increase, below 1 is a decrease, and it seems to be landed really, really well. Very simple concept. Yeah. If you speak to the academics and the modelers, they're not happy with this as a measure of anything. Of course, we'd like to move on to something else. But the ease within which the public understand that concept means that it's actually a critical measure in its own right. So things like that. Heat maps work very well. So there's a lot of heat mapping going on, and maps. So geospatial has become a large focus of the work that we do, being able to really identify, particular areas of concern. One of the challenges that we've had advising ministers over the course of time, and bearing in mind that Matt Hancock has been a huge advocate of using data and is very data savvy. He's always been a minister that advocates the use of data. So we've been very fortunate having him over the course of the pandemic, is the interpretation of multiple different types of data that come up into some of the decision making, and looking for ways in which we can put, hospital capacity and case rate and understanding of vulnerable communities. So the variables of those together into something that immediately enables people to understand the risk concept that they're dealing with. Yeah. That's been, sort of one of the ongoing pieces that we're trying to do, rather than land a large table in front of a minister and expect a decision to be made.
To work it out, yeah. I mean, it's interesting because you're having to create and present data in a way that helps tell the story. That's then needing to be interpreted to the general public so that they can understand what's happening and tell the story. And then also us, the citizens, general public, are then needing to use that information to make our own decisions, particularly as we, I guess, come out of the tight lockdowns that we've had, and we're being asked to use our own sort of initiative a little bit more. We need data, right? People want to know. People generally want to keep safe, and people will want to know. So almost the thirst for data, the thirst for an understanding that should, in theory, go up as we sort of head out of lockdown in some ways.
So one of the key part of those has been disseminating data into the public realm, and the COVID-19 dashboard has been key to us with that. So And that's been an incredible piece of work by PHE colleagues that actually won an award from the Royal Statistical Society last week for its vision and the way in which it's communicated.
I didn't know there was something called the COVID-19 dashboard. Have I seen that? Is that like on the news, or is that one that's more in the background?
Yeah, no, it's the common dashboard. If you Google, we call it internally the COVID-19 dashboard.
I'm sure it'll have a different name. I just love that there's just one, there's one thing, the COVID-19 dashboard that's used and looked at. It's great. Brilliant. Oh, that's again another fascinating insight into discussion about the challenges of understanding complex data, but more importantly, turning that into stories and simple messages that people can get and understand. And it's a great case study for data and insight for and how people need to think about it. So just as we start to wrap up, it'd be good to sort of look forward a little bit. Obviously, there's a lot of work that's been done here. Every country, every government, everywhere, every corner of the world is being touched by this. What's the kind of plan, I guess, for this department, UK Health Security Agency in the UK, but also more broadly than that? Is there a global play here in terms of the learning, the messages, the communication, the understanding, the retrospective that's done at either a G7 or sort of more global scale?
Yeah, so inevitably, those announcements and commitments that came out of the G7 need to be worked through now into plans, and both at a national level, because remember we work very closely with our devolved administrative colleagues, and so we are 4 countries and devolved in health. Bringing that together is one of our pieces of work, and we've really enjoyed working with the devolved administrations on a lot of the outputs that we've produced, but then also beyond that as well, and what does that capability need to look like? And that of course goes into systems, into architecture, into standards, into the data itself, and also raises many privacy and ethical concerns from a UK citizen point of view, that will be part of the work of the next year or so to actually test out with the public and work out what the appetite is, to be able to take that forwards.
Yeah, and I guess I suppose with the vaccine, the only way you break this is by everyone elevating their capability in managing health security. So I guess there's a sort of thought lead and global sharing thing that I'm hopeful is happening or is planned to happen, where the best practice from all the different countries and different ways that certain things, and there's nuance of course that have taken place, is shared more generally, so that we can elevate how good the world is at dealing with this kind of thing.
No, absolutely. And we're leaders in this. So our genomics is far advanced. Our vaccines and the development of vaccines has been far advanced. And the work that we've done testing and tracing in the operations there, again, is world leading. So we're in a really good position from a health security perspective. Others are following and coming through, of course. But, it's always worth to note that if you look at some of our assessments, with regard to international, there's many countries that are not testing sufficiently and do not have an understanding of how COVID is affecting their communities. And I'm sure we've all seen news reports from countries that have seen high death rates, but not quite understood where that's come from or how that's been. Or leaders who haven't got behind the COVID campaigns and have actually taken the position that the virus would just move through the communities without any interaction from government and public health. So it's a real patchy picture from a global health security perspective. We can lead the way and bring others with us, and certainly take temperature checks and help bring those together who are not quite on the page at the moment. But it won't be a quick fix from a global perspective, I would say.
Well, Johanna, it's been absolutely brilliant talking to you about this. Such brilliant insight into what's been happening. I'm sure there'll be lots of opinion and judgment and discussion about the things that you've said, but I think the debate's important actually. And so I appreciate you coming on the show and being open and sharing your experience. And I congratulate you for stepping into this role, because I know it was an interim short-term thing to begin with, and you've ended up staying and doing a fantastic job by the sounds of things. So thank you for coming on the show. Thank you for sharing. Great to talk to you again.
Good to speak to you.
Brilliant. And thanks everyone for listening. I hope you enjoyed today's very insightful discussion. There's plenty more to come as always, and we look forward to talking to you again soon. Thank you so much for listening to the Hub Unspoken podcast. Don't forget to check out our website and subscribe to our newsletter at cynozure.co.uk. Bye for now.